So we have a 40-year-old smoker which presents with a soreness of tongue since last 2 months. On examination, it is found that the oral hygiene is poor and there is a white plaque over the lateral border of the tongue. What is the next step in the management of this patient? Oral vitamin C supplementation, oral antifungal treatment, edge biopsy of the lesion, or the local topical cauterization. So we have certain hints in this question. The one is the patient is smoker, so which is a risk factor for malignancy. Then there is a soreness of tongue, which is the clinical feature of the oral malignancy as per the Bailey. And then the symptoms persist for more than 4 weeks, so about 2 months. Then we have the white plaque, which can be leukoplakia, and then it is on the lateral border of the tongue. So lateral border of the tongue is most common site of involvement of malignancy in case of tongue. And there is a poor oral hygiene. Poor oral hygiene. So these all risk factors are indicating toward the suspicion of oral leukoplakia, or a pre-malignant lesion, or early squamous cell carcinoma, which is the most common carcinoma of the tongue. So this is indicating toward the carcinoma. So if we are suspicious of malignancy, so we must do the edge biopsy of the lesion. So the correct answer will be the C. Now the thing is that why to do edge biopsy? Why not the biopsy from the center? So the edge contain both the normal tissue plus abnormal tissue both. So this will be giving the best histopathological diagnosis. But if we will taking from the center will be having the necrotic tissue and it will be non-diagnostic. And we have to remember a dictum that if there is a white plaque in a smoker, consider it to be leukoplakia until proven otherwise. So the correct option in this case will be the C, the edge biopsy of the lesion, and this is also correct as per the answer key. Now going to all other options. So oral vitamin C supplementation. So examiner wants us to think in the direction of scurvy, that is vitamin C deficiency, scurvy. So the scurvy, there will be bleeding gums, which is not present in this case, and there will also be the poor wound healing. Scurvy is not going to cause the leukoplakic plaque, which is persistent on the lateral tongue in a smoker. So giving oral vitamin C supplementation will only delay the diagnosis of malignancy. So this will be the incorrect option. So A will be the incorrect. Wrong. Now if we're going for the second option, the oral antifungal treatment. So for the oral antifungal, the examiner wants us to think in the direction of the oral candidiasis. So oral candidiasis. See, the candidiasis can present in this way, that there will be white curdy plaques which can be scraped off, and there will also be underlying erythema. But because in this question there are certain hints like the patient is smoker, there is also persistent lesion, the site is also high risk site. So we have to consider it to be first the malignancy, and we have to rule out if it is malignancy or not. In this case, we find out to be the fungus, then we will be starting oral antifungal treatment, it will not be the next step. So giving the empirical antifungal treatment without diagnosis, without biopsy, is not appropriate. So this will also be incorrect. Now coming to the last, the local topical cauterization. So never cauterize a suspicious oral lesion before diagnosis, because in that case we will miss the carcinoma it will lead to delay in the treatment. It would also the alter histology if we will be doing later. So we will be first to do diagnosis and then we will be going to treatment. So this is also incorrect option. So the correct option will be the edge biopsy of the lesion.